We start this hour with the U.S. COVID crisis. 148,000 new cases reported yesterday, according to our own NBC News tally. That is the highest single-day total of this entire pandemic. Many states are now reintroducing safety measures they haven't had since the spring, as the number of people in the hospital hits all-time highs.
Having served medical care in an actual war feels very similar to this, where we're fighting a war against this virus.
Our NBC team is on the ground in coronavirus hotspots across the country. NBC News correspondent Morgan Chesky is in El Paso, Texas. NBC News correspondent Gabe Gutierrez is in Minneapolis. And NBC News national political reporter Josh Letterman is in Bethesda, Maryland. Morgan, let's start with you. El Paso's health department reporting 29 new coronavirus-related deaths this morning. It's just terrible news. What else are you seeing there?
Now, Allison, we're seeing a crisis deepen by the day here in El Paso. Earlier this week, we saw some of those mobile morgues arrive. By the end of today, we anticipate 10 of them to be in place here in El Paso. Those are the large refrigerated units that have now had to be brought here simply because the morgues are running out of room due to the death toll rising daily here. We do know that hospitalizations rates are skyrocketing, and hospitals have had to, in some instances, double up room capacity, 2 patients to a room. We know that doctors have been brought in from the Army, from the Air Force, treating those most critical, and tents have been set up around area hospitals to try and handle the influx of these patients. I had a chance to speak to one of the doctors who tells me that this is unlike any crisis he's ever dealt with before. Take a listen.
Without a certainty of whenever this is going to end or when the spike's going to go down, we just don't know. So that creates anxiety, but we're able to understand that. We've developed our processes, our plans to deal with the surge, and that's what we've implemented.
And the medical officials here tell me they have resources to handle their current number of patients, but there is an imaginary wall out there, Allison, that if these numbers continue to go up, they said that it's a worst-case scenario. They're trying not to hit, but at the same time, a very real possibility. Allison.
Morgan, Texas's governor says that he is sending more resources to help El Paso. What's the plan? What are they trying to do there?
Yeah, well, this has been kind of an ongoing process, specifically since October when these numbers started to tick up. We know that a field hospital has been established here in the El Paso Convention Center. Initially, only 50 beds were set up. Governor Greg Abbott saying last night that by the end of this week, that number will be doubled to have 100 beds there to handle some of the more stable COVID patients. In the meantime, we know that there are more state resources, healthcare workers being sent to help out as much as possible. Those tents that I mentioned that are set up around the hospitals will be staffed by some of those healthcare workers. We know that travel nurses have been flying into El Paso by the hundreds, working 6 days on, 1 day off, 12-hour days, doing whatever they can to try to treat these patients, while at the same time watching those case numbers rise in the very community they're serving. Allison?
Morgan, an El Paso County judge extended the county's stay-at-home order through November, but we're hearing the state's attorney general is going to the courts to try to get rid of that order. Can you tell us more about this and why it is just so controversial?
Yeah, this is a shutdown order that the entire state has been watching, essentially because it's pitting El Paso County against a local restaurant group that sued them and the Texas State Attorney General Ken Paxton. They are saying that the county judge here, Ricardo Samaniego, has overstepped his authority by issuing this shutdown that closes non-essential businesses, establishes a curfew, and basically makes it to where there's limited travel in some instances, all to try to cut down on potential interaction to keep those case numbers low. Now, we know that their argument is basically saying that by shutting down the local economy, you are taking potential profits away from business owners. At the same time, the county judge tells me that if these numbers continue to go up the way in which they are, it will only be longer before this city can return to normal. So there is an appeals court that is expected to make a final ruling on this tomorrow, whether or not this shutdown will remain in place. It was extended as of this morning, and it could potentially run into early December. Allison?
All right, Josh, let's go over to you. In Maryland, the governor is bringing back coronavirus restrictions. The state there setting new coronavirus records every single day for the last week. Tell us more about what's going on and what Maryland is trying to do to deal with it.
Yeah, so Maryland and the National Capital Region is a good example of how barely any part of our country is no longer touched by the crisis that is raging across the nation. This is an area that had been doing fairly well up until recently, but now every single indicator, according to the governor, is getting worse. More cases, more hospitalizations, more ICU admissions, and now more deaths, with the state now tipping above 5% positivity, which for the governor said that the state now is in what he calls a red zone. And so while Maryland isn't formally going back into phase 2, a lot of the restrictions they're putting in place are very similar to what they did have in phase 2 back when we were dealing with this in March and April. So the governor here limiting restaurant and bar capacity back down to 50% for indoor service. And here in Montgomery County, where I'm at, they've lowered it even further to 25%. But meanwhile, statewide, they are also forcing employees for the state government to go back to telework and reducing the limits for gatherings to 25 people as they try to get the situation under control here.
Josh, Ted Delbridge, the director of the Maryland Institute for Emergency Medical Services Systems, is warning that cases will peak in the winter. Now, we know that could still be months away, and things are already pretty bad. What happens if hospitals there max out? What's the plan?
Yeah, well, so far they've been okay with hospital capacity here, and they're helped with the fact that there are some significant hospital resources here in Maryland, such as Johns Hopkins University, which we've all, of course, been following their modeling of the pandemic. They do have surge capacity here, just like Morgan was describing in Texas. So far, they haven't really had to tap into that. But the biggest thing, Allison, that they're trying to do is to avoid getting to that place by trying to keep the new transmissions under control, including through the new contact tracing app that Maryland has rolled out just this week. They've already got about 500,000 people who have enrolled in this. We got a chance to take a look at how the app works, and a lot of people think that these apps actually are tracking your location. That's not what it does. It's transmitting a randomly assigned number to other phones that come within that 6-foot radius of you, keeping track of that, and then once a day downloading a list of everyone who's tested positive and submitted their information into the system, so it can let you know you might have come in contact with someone, you should probably get a test or quarantine for a while. That is the biggest thing that Maryland authorities feel that they can do to avoid getting to a place where they run out of hospital beds.
Josh, if I had that app, I would be tapping it to refresh as much as people were over the weekend tapping to see the election results. Seems like a pretty good idea and something that could help a lot of folks out. Morgan, Josh, thank you both. Coronavirus records crumbling in Minnesota. The state reporting 7,000 new infections in one day for the very first time. NBC News correspondent Gabe Gutierrez got rare access inside a COVID ward at one of the state's major hospitals.
Allison, Minnesota just broke another daily record for new COVID cases, this time more than 7,200. And we got rare access inside the COVID ICU inside Abbott Northwestern Hospital here in Minneapolis. It has about 30 or so COVID ICU beds. Right now, about 3/4 of them are full. And the doctors and nurses we spoke with here say that they're concerned over the next couple of months, not just because of bed space, but they're also concerned about potentially staffing issues as the community spread continues here in this state. New COVID cases have jumped in Minnesota about 135%, Allison, over the last 2 weeks. And we managed to speak with one COVID patient who is still recovering here in the hospital, but she's been in here for about a month and a half. Her name is Kelly Meeker. She is 36 years old. She coaches gymnastics. She loves her family, but the most frustrating part of all this, her mother says, is that she wasn't able to be with her daughter when she was at her sickest. She just got off a ventilator several days ago. And as I said, she's now in recovery and out of isolation. Take a listen.
What would you say to people who are skeptical that COVID is really that serious?
I'd say wear your mask because I almost died from it. It's more serious than people think. I just think people aren't taking it serious enough.
And Mom, how tough has it been for you?
Oh, hard. I said, yep. Really hard.
What was the hardest part?
Oh. When we couldn't see her, that was the hardest part. It was just helpless. I mean, nothing you could do. You couldn't hold her hand. That was probably the hardest.
It will be a long road to recovery. Just yesterday, Kelly was able to take her first steps since getting out of that coma. Her mother is thrilled and so grateful to have her daughter back. But again, she could have months of rehab ahead of her. It's just such a devastating situation for so many of these COVID patients. Even those that make a recovery still have to deal with these long-term impacts. Many of them do. And right now there are many who are inside, unable to communicate directly with friends and family except maybe through a Zoom call or a FaceTime. It is frustrating not just for those patients and their families, but also for the medical workers who are also dealing with an incredible amount of stress right now. And Minnesota also just reported another record when it comes to daily COVID deaths. Allison.
More than 65,000 Americans are in the hospital right now, according to the COVID tracking project. Dr. Fauci saying help is on the way, but don't let your guard down yet.
Help is really on the way. You know, if you think of it metaphorically, you know, the cavalry is coming here. Vaccines are going to have a major positive impact. So if we could just hang in there, do the public health measures that we're talking about, we're going to get this under control, I promise you.
CDC-trained epidemiologist Dr. Kelly Henning joins me now. Dr. Henning, thanks so much for being with us. Daily cases, hospitalizations, breaking records in all sorts of cities, states across the country. These numbers are worse than they were in the spring. But Dr. Fauci sounded pretty hopeful there. Are you?
I think we're going to face a really tough couple of months. But the optimism comes from the fact that we now have vaccines on the horizon, and we're starting to hear some really good news about vaccines. But at the very immediate moment, we have remarkably large numbers of cases occurring, as well as increasing hospitalizations and reduced capacity in ICUs. So we have to take this very seriously. The thing that's different now from the spring is that the whole country's involved. Really, if you look at the map, there's no region that's spared. It's really every state that's facing growing numbers of cases. So we have to take this very seriously.
On the vaccine front, Moderna is saying that its phase 3 trials are finished and it will know by the end of the month if its vaccine works. What kind of data, what kind of results and information will you be looking for there?
So Moderna has a messenger RNA and mRNA vaccine very similar in structure to the Pfizer vaccine that was discussed just a few days ago. In the case of the Pfizer vaccine, they're reporting 90% effectiveness of that vaccine, which really exceeds what most public health and medical professionals expected. So we would hope that Moderna may actually have something similar, but we'll have to see when the data comes out.
Chicago Mayor Lori Lightfoot is bringing back a stay-at-home advisory in her city starting Monday. Here's what she said about it today.
Stay at home unless you must go out for essential reasons like work or school, medical visits, or to get food. No visitor should be in your home unless they're essential workers like home health care or education workers. And no visitors includes family members that do not now today live with you.
Do you think that more cities and states need to take these kinds of measures?
You know, it's interesting when you look at these measures around the country, states and cities have a real patchwork of measures. There's a little bit of stay at home. There's a little bit of mask wearing discussion. It really varies by where you are. And it's really about following the data. We want to keep people safe. We want everyone to wear masks when they're not at home with their loved ones. And we want people to stay their distances. And if the data shows that increasing cases and increasing deaths and increasing hospitalizations, then the political persons in charge are going to have to issue more stringent stay-at-home orders. We'd like to avoid mass lockdowns because that is really problematic for the economy and for many other aspects of life, but we do need to keep people safe.
How about the 10 p.m. restaurant and bar curfew in New York and New Jersey? What do you think of that rule? Is that effective? Does it make sense?
I think we have to see.
Okay.
One thing about New York is they have extremely good data. They report their positivity rates by county, by neighborhood, basically every day. So when they put these orders in place now, I think we'll be able to actually judge just how effective they are. In theory, what they're trying to do is reduce crowded locations with lots of people close together. And we'll see if this is enough or if they need to do more.
You're not kidding about the New York data. My mom loves to check in with me and let me know how bad it is where she lives compared with how I live. I mean, you could really hone in and see just what's going on in different neighborhoods. I'd like to play what Dr. Fauci said about whether the slow transition from a Trump to a Biden White House will make it harder to get the virus under control, and then get your take on the other side.
The medical part of it just keeps going forward. I know this is what I and my colleagues do every day. One, getting the message to the American people like we're trying to do this morning, but also pushing ahead on the development of vaccines and on countermeasures.
A lot of talk about the health of our democracy, but what about actual Americans' health? Are you concerned about this transition and how it could affect our well-being?
So the U.S. has wonderful institutions, CDC, NIH, FDA, and remarkable scientists, Dr. Fauci being the lead among them. So we have these institutions and these persons in place, and I'm hopeful that as we transition into the new administration, those will continue and only get stronger as we have increasing leadership.
Dr. Henning, it's been a little while since we've seen you. I know that means that things are getting worse, and we're checking in with our doctors more often. Thank you so much for being with us and helping us navigate what's going on.
Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.